City Council will meet on Thursday, May 14th at 7 p.m. remotely to hold its regular meeting for the purpose of discussing any and all business via remote participation in accordance with Chapter 40A of the Massachusetts General Laws and Governor Baker's emergency order dated March 12, 2020, pursuant to Governor Baker's March 12, 2020 order, suspending certain provisions of the open meeting law, General Law 30A-20, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Salem City Council will be conducted via remote participation to the greatest extent possible. Specific information and general guidelines for remote participation by members of the public and or parties with right and or requirement to attend this meeting can be found on the city's website at www.salem.com. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technology means. In the event that we are unable to do so, despite best efforts, we will post on the city's website an audio or video recording, transcript, or other comprehensive recording of the proceedings as soon as possible after the meeting. For this meeting, the members of the public who wish to watch, listen, and provide comment during the meeting may do so in the following manner. Please click the link below, which is on the city's website, and the password, if necessary, is 789602, or go to the website link zoom.us.join and enter the webinar number 823-8549-7935, and followed by the password, which was just given earlier, 789602. Participants can dial in toll-free by using the number 888-475-4499. To join the meeting, when prompted, enter the meeting webinar ID 823-8549-7935 and follow the instructions to join the meeting. For those dialing in, you may press *9 to raise your hand when you're during to speak if you signed up for the public comment period. This meeting is also live on SATV. Members of the public who wish to speak in the agenda must follow the how to sign up for public testimony outlined on the agenda. Members of the public attending this meeting virtually will be allowed to make comments if they wish to do so during the portion of their hearing designated for public comment. See agenda for the public hearings.
There are none to.
The clerk. Let's see. City of Salem, May 14th, 2020, City Council regular meeting. Members of the public wishing to speak on the items. Wait a second, hold on.
Page 3.
Redundant. City of Salem, May 14th, 2020, City Council regular meeting. A regular meeting of the City Council is being held remotely on Thursday, May 14th, 2020 at 7 p.m. for the purpose of transacting any and all business. Note that this meeting was posted on May 12th, 2020 at 8:37 a.m. This meeting is being taped and is live on SATV. Currently, all members of the council are here. Council President McCarthy presided. Councilor Riccardi moves to dispense with the reading of the record of the previous meeting. All those in favor? All those opposed? Let the record reflect that I saw 10 hands on the screen plus my own, making 11. I now request that everyone please rise to recite the Pledge of Allegiance, led by Councilor Flynn.
I pledge allegiance to the flag of the United States of America,
United States of America.
To the
to the
republic
republic for which
for
it
which it
stands,
stands, one nation, under God,
under God, indivisible,
with liberty,
liberty, and
justice for
justice
all.
for all.
Thank you.
One day we'll get better at that. It's like a little lag between when we're doing it. I will now take a motion by Council Terry to take out of order the update from the mayor and Mr. Greenbaum. Oh, wait a second.
So moved.
That's Council Masillo. Council Masillo.
Thank you, Mr. President. I'd like to take an item out of order, go to page 7, so we can hear from the mayor and the health agent.
Thank you. Seeing no objection, Mayor Driscoll and Dave Greenbaum, please.
Good evening, councilors. It's great to be with you again and to provide you with a brief update on efforts related to our COVID-19 response. I'm joined by Health Agent Dave Greenbaum, and him and his team have just done an outstanding job working through some very trying circumstances, and I appreciate him carving out as much time to not only provide updates, but all the work he's doing in between updates and Zoom meetings relative to our public health and trying to address our needs going forward. I'm going to share screen. Dave, I have some of the data. Maybe you want to get started going through that if folks are up for that.
Yep. So good evening, councilors. So as of today at 2 o'clock, Salem had confirmed 508 cases of COVID-19. Of those 508 cases, 303 are active or still under investigation. We had 205 clear their isolation period. And we unfortunately have a total of 24 COVID-related fatalities. So I think we're in the direction that we want to be going. Active cases going down and clearances from isolation going up.
We talk about these lines, the orange line obviously being the active cases and the blue lines being the folks who have recovered, and wanting to see the blue line go up and the orange line go down. And that is certainly trending that way, which is following very much where the state's at as well. Not as fast as we'd all like, but certainly trending in the right direction. Again, these are just other ways of showing the same information that Dave went through. In addition to the health information, we're obviously pivoting towards the budget. As the council knows, we certainly have a lot of work ahead of us to try and balance the budget for next fiscal year. We thought we'd just share some information on the snapshot of a couple of revenue streams in April, just to give a year-to-date comparison from what April of 2019 looked like in comparison to April of 2020. And you can see the steep drop-offs. Some of you were obviously many of you were updated on this previously, but just for folks at home who may be following along the trials and tribulations of post-COVID, certainly budget implications are going to be very severe here in Salem. We've already seen within 1 month, $300,000 loss. This is just April in parking revenues. And there are some other revenues here, the golf course, which the golf course was just cleared to open a week ago. It was under an order not to open all throughout April. But we've had work going on at the golf course, and it continues for folks who are following that. The cart paths are being redone. It's a 2-phase project. The first phase is wrapping up. We hope to have the golf course open by June 1st. I think Paul Lieber, who does a great job as the golf course superintendent, is actually pushing for sooner, but he's telling everyone June 1st with the goal of opening sooner than that. And the cart paths look lovely. They're getting there. They're just not completed yet. But you can see, obviously, golf course revenue April last year was much higher. We weren't able to open the course this year, even if we weren't doing work because of the emergency order. And then things like Witch House, recreation programs, Winter Island, all combined. And this doesn't include meals or hotels or cannabis or building permit fees, but this is $500,000 in comparison from last year to this year. And just you can see the trend line, just about every single receipt we've had, up until COVID, we were trending the right way with many of these. And unfortunately, we expect significant impacts to the budget. So I'm gonna stop the share, and we'll be talking more about that, I know, during the budget update. We're still hoping to get the budget to the council in June as early as we can. We think we've got a stronger handle on revenues, although the state is telling us, and they've been really clear, the state's upside down, so we recognize that local aid is going to be impacted. We're just trying to get a real better understanding of what that is. It could be anywhere from 5% to 20%. And in speaking with our delegation, who I know is working hard to provide us with as much dollars as possible, but it looks like the state is going to be so strapped that it's probably going to be closer to the 20% number than the 5% number. And that's about 25% of the revenues we count on. We're making projections of 50% with respect to things like meals and hotels, and that may be generous. We're going to try and zero in on that. The work ahead of us for the next several weeks is really trying to curb expenses. Where can we identify potential savings, and frankly, where are we going to make cuts? We're going to need to partner with our employees, our unions, and our constituents to help us understand and work through not only the next year. I think everyone's looking at this sort of like a 2-year cycle. This year, obviously, we're impacted. We're in the throes of it. But the entire year, if we don't have the sort of revenue stream, not just us, but the state, that's going to impact next year's local aid and next year's revenues. So we need to approach this looking at it through a 2-year window. We've worked hard to save money and do have a rainy day fund, but it isn't something we can just raid 100%. We had an opportunity to speak with both Senator Lovely and Representative Tucker, but after that I had a chance to speak with Senate President Spilka, and the numbers are staggering. The state's got like a $5 billion budget gap just right now. Like, that's not even a projection into the future. There's about $3 billion in the rainy day fund, which is pretty significant. They've worked really hard as a legislature and administration to sock away some money. and they're going to tap that. But like us, they can't tap the entire rainy day fund. You need to have some available for the long term, in this case, at least 2-year window of what could happen. And we still don't know if a second wave of COVID would occur. So we need to be sort of smart in this approach. And we're going to work hard to try and limit the pain and the impact on services. But it's definitely not the budget we were hoping to give you when we started this fiscal year. And not the budget I think anyone is happy to produce. It's just the budget we're going to have to live with given the circumstances that we have. I thought I would just take a minute to talk a little bit about community testing. Dave Greenbaum and his team, we've been working hard with our healthcare professionals, including North Shore Medical Center and North Shore Community Health Center, to try and stand up a community testing model, really focused initially on the hierarchy of what we consider to be high risk in individuals and constituencies. That would be seniors, congregate housing, homeless individuals, again, living in congregate housing, frontline workers. These are folks who are in the essential category and are going to work every day, particularly those that have a lot of interactions with the public. So think about grocery store workers and others, first responders, certainly, and to have a model that we could make sure that vulnerable population is tested, even those that are asymptomatic that fit within that category. We're not going to be able to set up a program and just sort of say, hey, state, you run it, or hey, hospital, you run it, or hey, health center, you run it. There's so much work that's involved in doing that it's going to take a piecemeal approach, working with both our EMS provider. Some of these constituents are going to need services brought to them. So think mobile test clinics and on-site centers, and some will be able to accommodate through a drive-through center. Just today, Walmart, we partnered with Walmart and a testing agency there to set up drive-through facilities for testing. I think Councilor Dominguez, you may have been one of the first customers through this morning. That will be there Monday, Tuesday, and Friday, 7 a.m. to 9 a.m., where you make appointments in advance. If you fit into that high-risk category, anyone who's an essential employee, you are tested whether you're asymptomatic or symptomatic. So this has been a real need. We feel especially we're not testing enough of the asymptomatic people, knowing that the virus can be transmitted by folks who are not experiencing any symptoms. So important to get those folks tested. And obviously, if they come back positive, to work through the contact tracing and make sure they're quarantining. That's the real way we're going to, curb the spread of the virus. And it's important that we do as much testing as possible, followed by the contact tracing model. So the testing that's going on at Walmart is being done for free. They're not charging anybody for that testing. There's no insurance requirement. And again, if you're an asymptomatic essential employee or a first responder, you can get signed up to get tested right away. If you are if you are not fitting in that category, and there certainly are a number of folks who would like to get tested who are not symptomatic and don't fit that category, they can't take you yet. You still should, if you're symptomatic, they can take folks through that model. But if you're asymptomatic and don't fit the categories identified by the state, they're not able to take you. But we are encouraging people the number of us who are essential employees, to please go get tested. It's something that we know is important to generate more results so we can know where we stand as a community. What's our % positive? If you are somebody who's asymptomatic and happens to have COVID, we want you to quarantine so we don't continue spreading it, and that's a key for us. We're also working hard to try and get centers stood up in those places where we need to go to individuals. That would be things like the Charter Street, 27 Charter Street Senior Housing Complex, other senior housing complexes in Salem that aren't necessarily congregate, but they're certainly tight and dense in our high-risk population. And they do have common areas, laundry rooms and mail rooms and things like that. We're hopeful that in combination with our healthcare partners and our EMS provider, we'll have dates soon for stand-up facilities at those sites. And I guess I also want to say, we're focused on the testing because we think we need to do more testing as a city, as a commonwealth, as a country. The governor should be commended. I mean, there's an amazing amount of testing going on. If Massachusetts was a country, we'd be ranked 4th after Israel, Iceland, and Italy. Those countries are testing more than Massachusetts, but we're 4th in line. There's no other state in the country right now that's doing more testing than Massachusetts. And through the governor's efforts, they've stood up this contact tracing effort very early. Folks, other states are coming to us to understand how it's operating and what they can do to advance it. So that's really the key as we pivot towards reopening, to ensuring that we we can curb the spread of the virus, and we also have an ability to know if things are going the wrong direction and need to dial things back. So we want to get to these vulnerable populations where we have to go to them. And we're working with partners. We hope to have some dates, not just for the testing, because, the testing is a snapshot in time. Dave could tell you this too. You can be negative on Monday and positive on Friday. The real effort around going to the high-risk populations where we need to go to them will be making that contact, providing them with a facial covering, making sure they're vigilant in hand washing and practicing physical distancing, and calling us if in fact their symptoms shift or they begin to have symptoms. And that touch point, I think it was the community health center physician, Damien, who said, it's really this whole ounce of prevention is worth a pound of cure. If we can remain vigilant, we know the weather's going to get warmer, things are going to start to loosen up, and people are going to let their guard down. It's really, really critical that we stay the course and keep the physical distancing, keep washing the hands and sanitizing the hands like crazy, wearing those facial coverings, and all the other, sort of risk preventative behavior is really key to helping us curb this and beat it back once and not have to go back to a point in time where we have emergency shutdown orders and things like that. So we're hoping to have some dates for community testing models at those various locations. We're working that hard now. We don't have dates yet, but we have a discussion tomorrow, which we hope will inform that some more and can get some dates going. And again, make those touch points so we can keep in contact with individuals. The Reopening Advisory Board, if you're following that at the state level, they're planning to release their report on Monday. I had an opportunity to make a presentation to the board earlier this week, along with my colleague, Mayor Curtatone from Somerville. We were representing a number of municipalities, the North Shore Municipal Managers Association, so mayors and managers in the North Shore, and Mayor Curtatone works with the Metro Boston Mayors and Managers Association, a similar organization there, representing mayors and managers for greater Boston communities. And some of the things we focused on during the presentation, most of the individuals or organizations presenting to the board are industry leaders. So you might hear from the Mass Restaurant Association or mass retailers or other important industry groups, manufacturers, high tech, others who wanted to proffer up, why they think, why they're ready to open, what their concerns are, what the advisory board should be thinking about. And some of the work that we thought was important for the advisory board to hear from cities and towns at the local level, we're really making sure that any of the steps we're taking towards reopening and recovery, that they're, really grounded in science and data. That, I think the governor's said this several times, it's going to be slow and steady. We need to make sure that we're not doing anything that's going to, lose ground in all the hard work that folks have done to get us to this point. But we think that data is really important. What metrics are we using? What metrics will we look at if we have to dial things back? And how do we make sure that's very transparent and everyone's aware of that? So there's no surprises. If we start to see certain triggers going down, everybody's aware, we're going to have to take certain actions. And what would those actions be? So we're pushing for certainly that information to be well defined as part of the reopening board's efforts. We also think every approach here needs to be sort of coordinated and regional. We can't have one set of rules in Boston and another set in Salem and something different in Worcester. There might be regional differences if you think about where cities and towns might be at or where health factors might be at, but we think it's important that communication really work well. The state can't just open golf courses and not tell us, or have it come as a surprise that we're going to start new practices, given the fact that all the local authorities really have to enforce it. And I think they hear that too. They've been a good partner. We just want to avoid any miscommunications and make sure that as things are getting enforced, they're aware of the impacts at the local level, and as guidance is coming out, that we have a hand or a voice in that. We also think the equity is an important issue. There are certainly, as we look at what's happening now, you can see holes and gaps in social networks and infrastructure that are being magnified, whether it's around food or housing. So we think certainly we need to be paying attention not just to the big industries, but to Main Street businesses as well. The small mom and pops that typically aren't as well capitalized, don't have the wealth of resources to sort of hang out and wait for something to get better, and to make sure we're thinking about our recovery efforts and keeping them in mind. And then obviously prioritizing health and welfare. I always feel like there's this tug of war right now between, between public health and public wealth. Well, the scale, the finger on the scale has got to be on public health. And I think certainly the governor recognizes that, and the need for us to be, in lockstep on that is important, and that's moving forward. The last thing I'll touch base on is reopening of City Hall as we start to pivot towards what a reopening of City Hall will look like. That we do think on May 18th, there'll be a slim or a small list of businesses that are in that phase one that will be allowed to begin to think about reopening. under certain, guidelines, things like reduced occupancy, obviously enhanced cleaning. Some of that has already came out, cleaning and sanitization efforts, and a real push to continue folks working remotely if they can, just to avoid the high-risk areas. If everybody in an office tower has to go back to work, that means there's going to be people on buses and in train stations, and those are those larger sites that are vectors for, transmission. So the goal would be to try and allow work to happen in a safe way, but in a diminished capacity, so that we don't create risks that are going to put us back to where we were several weeks ago. So we're going to be looking at what date we think makes sense to reopen City Hall. We'll be following those same guidelines that are released by the state with respect to diminished numbers of individuals, working staggered schedules. We've been really productive working from home. We've actually seen more phone calls into the office, in my office in this April, than we saw last April. I don't know if that's a reflection of you can't really walk through the door, so everyone's calling, but there's a fair amount of work going on. We're really impressed with the way staff have sort of pivoted to working remotely, bringing things online. I think if we tried to do it when it wasn't a pandemic, we would have found excuses and reasons why it couldn't happen as well as it has right now, because we had to do it. It's been certainly nice to see that happen. I think there'll be some of those work from home, remote learning, staggered schedule flexibilities that we'll keep in place post-COVID for sure, because it's working pretty well, and that will also help us in meeting some of our concerns with respect to keeping staff healthy and members of the public healthy. But we don't have a date in mind. I think it'll be sometime in June. That's what we're targeting. We've already started to look and work on, when you get into City Hall at some point, you'll see partitions that are up for plexiglass, and there's some desks being moved to allow for the physical distancing that we need. And again, those flexibilities will be brought to bear. We also have a task force that's been created around reopening schools. There's a little bit more lag time there, but there's 5,000 times as much work thinking about getting schools up and running. Everything from transportation to staff to student distancing to schedules. There's just a lot of components to that. We've had some discussions about working collaboratively with Beverly and Peabody, I think, on sort of bringing on some technical assistance to work with all of the communities who share kind of similar issues, and to project manage our way through that. I know DESI's working on some plans too. So there will be an intense coordinated effort around that. And, I guess I would say stay tuned. It's very, very, it's very trying to sort of think about all those different components over the summer when our school officials are typically busy anyway, but we're beginning to unpack what some of that will look like. Lastly, just on the warm weather, it looks like it's going to be a great weekend. I mean, really warm, terrific, where we want to be mindful of that. We have put in place some additional, I guess I would say, regulations that we're hoping people will pay attention to. One is beaches. Right now, we really don't think it's safe for people to be camped out on a beach, sunbathing, bringing their family there and sort of camping out for the day. So the health department and the park and rec department have said, look, you can walk on a beach, you can run on a beach, you can swim at a beach, you can stroll on a beach, but if you're going to go hang out and sunbathe, it's going to be really hard to practice physical distancing. We're definitely going to have staffing out this weekend to make sure that we're paying attention to those rules. We'll have individuals at the gate at Waikiki helping encourage everyone to know what the rules are, and more importantly, to remind them to follow them. We have the typical rules are in place around face coverings. Dave, I'm going to break here and ask you maybe just to touch base on this issue, especially with the warm weather. I hear from lots of people who are saying, look, I'm seeing somebody walking down the street without a face covering. And the rules say, why don't you go through that so folks are clear on what some of the challenges are too?
Sure. So not only the local health covering order, but the governor's order does allow for some exceptions. Primarily, if you're indoors in an essential business where social distancing can't be maintained, you have to have on a face covering. If you're outdoors walking around, jogging, riding your bike, as long as you can maintain social distancing, you don't need to wear a face covering. The other two exemptions are for children under 2. So we don't expect people that are, children that are under 2 years of age to have to wear a face mask. Anybody that has small children knows how difficult it is for children to keep a hat on during the wintertime or gloves on during the wintertime. So it's the same concept. The other exception is if somebody has a medical condition. The medical condition exemption doesn't require any proof that you have a medical exemption or you have a medical condition rather. So if businesses ask and they're told that this person has a medical condition, they're allowed to enter the business without the face mask. So it's one of those things we just want to be vigilant about. If people can wear them, we're requiring that they wear them. And if they meet those few exceptions, then, we'll work with those people. You're on mute, Mayor.
Mayor, you muted yourself.
I'm sorry. I think one of the areas we hear about are folks who are walking down a street or jogging down a street and someone's passing them by. And what we're advising people, and especially this weekend, if it's warm weather, if you're going to a park like the Willows or Winter Island or Forest River Park, it's going to be crowded. There are going to be people out. So you should plan to wear a face covering. But the average person walking down the street, if there's not a lot of people around you, you're not necessarily required by any of the emergency orders to wear a facial covering. It might be a good practice, but I don't believe the law currently requires that. Is that fair to say, Dave?
That's fair to say. And just one thing I would maybe caution people on is if they are going to be out, it might be a good idea to have your face covering with you, maybe wear it around your neck or down around your chin. And if you end up in a crowd, you have it, you can throw it on and work your way through that crowd and then move on your jog, your bike ride, your walk.
Right. I mean, you don't know if the person that you're passing by is immunocompromised or, just has a real concern about this. So even if you're not constantly walking by to somebody, the ability to have a mask and put it on or a face covering and take it off when it's not always comfortable. I think we get that, especially on a hot day, but it just makes it easier if everybody's following the rules. Our public health officials are so busy. We don't need the police out stopping people for not wearing a face covering in a crowd. I mean, the rules are very clear. We do have signage that will be going up. I don't think it'll be up by this weekend, but signage that will be up in a number of public areas. And we have tried to identify some of the narrower corridors that are high walk areas to put some cones out and sort of extend the walkways to give a little bit more room so you don't have to completely, if you're with a big baby carriage, you can take over sometimes one whole section of the sidewalk just because the sidewalks are so narrow. So we want to give folks a little bit more room. We're going to try that as well, just to see if it can create more space. But mostly it's just about being smart, especially this weekend. There will be extra teams out enforcing. We do have the police going around with the loud horns. They also go into the parks. And we want to be clear, if you're coming into any of the beach areas, there's really no hanging out on the beach, reading a book, sunbathing. And it pains me to say that as a huge fan of Waikiki Beach, but at this point, we just feel like it's really necessary. We don't have huge, wide, expansive beaches. And if you just have a few people on there, it's going to be hard to maintain the proper physical distancing. Other than that, I know the Clam Shack's opening. We're all geared up for that in terms of making sure that they've got adequate protections in place. It'll be call ahead only. You won't be able to walk up to the window and just order. And I don't believe they're going to have their picnic tables. I know that we've had some discussions with them, Dave. Is that, have I captured what's going on there adequately?
Yep. So same as all the other businesses in the Willows, it'll be call ahead or order online, car side delivery or pickup. No sitting around at the picnic tables. I believe they're going to be removed, but we'll confirm that with Angelo tomorrow to make sure that he's at least roping that area off so people don't have access to it.
Yeah, a sure sign of summer. We're talking about the Clam Shack opening, and we're talking about drive-ins. So we have had a team looking at where we can put a drive-in this year. Josh, we'd love to talk with you about the O'Keefe Center. That seems to be one place that it will work. Salem State is supportive of the idea, but we know it's close to neighbors. And there's some other options that are considering. Winter Island is a spot that works. It's just only allows for 70 cars, and they typically have sold out pre-COVID. So we anticipate with all the pent-up demand, if there's a way for us to put on a drive-in at a larger location, we want to try and make that work. And with that, I'm happy to stop talking, and I'll happy to take any questions that anyone may have or concerns, please.
Councilor Turiel has his hand up.
Thank you. Yes, thank you, Mr. President. So yeah, a couple of things that I think, the drive-ins have worked great at Winter Island, but yeah, with the car limitation there, you can't, and that's even, they're packed in even in pre-COVID times. So Salem State, if we can make that work, is probably a much better location that you can get cars in and have some distance between them, and mingling without mingling too badly, but that can certainly work. The one thing, I have one question, but before that, one suggestion for people who are watching, who are trying to consider that, they're going to go out, they may not want to wear or may not be comfortable wearing a mask over their face the whole time because they're mostly not around people. Something that I have done myself is if you use like a buff or a neck gaiter, you just put that around your head and put that around your neck and then pull it up when you're around people, it's a good solution to the problem. So it's a good way to address it, that you can just pull on and off quickly. And when you are around people, it's worked pretty well for me as a method, and I suggest that to people. They're still generally pretty available from retailers because they're not as common as masks themselves. And then, so the question that I wanted to ask, it's great that additional testing site has opened up. Are we working on anything now at the state health or at the city health level to try and provide for antibody testing as those tests are starting to show up and become reliable? Because I know that's how we can get kind of the best picture ultimately of who has already had it that was asymptomatic and who may have recovered from it.
Yeah, I mean, there's some real progress being made. MGH is a leading, research institution that's heading up some of the best information with respect to antibody testing. It's not quite there yet, but they're making tremendous progress. At least, the opportunities that I have to speak with some of the epidemiologists and public health researchers on many of these weekend calls are just phenomenal. These are folks who are leading the country, not just leading Massachusetts. So we live in the epicenter of public health expertise, and there's some really good work underway. Some of what we're hearing is it's definitely not going to be antibody alone. You're still always going to need a COVID positive testing process, but there is some promise there. I don't know that we'd be happy to be a guinea pig for some of that if folks wanted to do some pilot programs here. We've made that fact known, but I don't think they're ready to roll out yet. But I think they're close. Dave, are you hearing anything on that front as well?
It's about the same. They are definitely working on it, and I think the recommendation is that if you can get an antibody test, that you do the COVID test at the same time,
Right.
so that you get the antibody test, you found out you had it, then you're going to have to go back and get the COVID test anyway. So you may as well just have both tests done at once.
Right. The two-part process is what they were doing down in Chelsea as well. So if you were positive, you had the antibody, then you got the test, and you'd know sort of where you stood right away. But we're chasing all that stuff for sure, Counselor.
Great. Thank you for the information.
Councilor Dominguez.
Thank you, Mr. President. To David and the mayor, as we prepare to open, might be on the 18th, I believe, according to governor and according to some of the cities, might be maybe later. Are you planning to have any blast on the announcement for people to follow up the distance, the social distance and the place on mask and everything? Are you planning to have, at least in the first week, providing that we're going to have a very good weather where might be a want everybody want to be out. So will you have something on plan to make sure that the first week, at least the first week, everybody understand that they need to continue to maintain the advice from the health department?
Yeah, I think we're planning on making sure that we remain vigilant in the message. As I said, we'll have signs going up in public places, downtown, parks, that the facial covering and the physical distancing, that is going to be with us for months. This is not just about the beginning, but we certainly want to reinforce it as the weather gets warmer and people see things opening. I'll also be clear, I don't think we're going to see a ton of things reopening on the 18th. I don't think there's going to be a switch that's just going to flip. I think it's going to be a slow, methodical approach driven by some of the data. But we need to continue to remind people. We need all of you to help us as ambassadors and to model that behavior and to share that information. And we're going to continue to make sure we're posting it, incorporating it into all of the public messages going out. And if you've got specific ideas on ways that we can spread that message even further, please let us know. We're using a lot of social media because, frankly, it's the thing that we are probably all doing a lot more of, but we know that's not the only way. It's just difficult to do the sort of typical canvassing that you might do given the COVID emergency that's in place. But we're open to ideas. I think many of you know we're still calling through seniors. We're talking about doing some other using some other calling opportunities just to try and connect with people so that they're aware of what the rules are, and also that we're touching base with folks who may feel a little bit isolated or hard to reach populations, just to make sure the message is getting through. But thank you. If you've got ideas, and Dave, anything else you want to add to that?
No, I would just reiterate that we are printing signs. that are going to talk about facial covering, social distancing, physical distancing. I think Tricia over at the Park and Rec is preparing some temporary signs, at least for this weekend, to get us through the nice weather on Saturday and Sunday. So I think the messaging will still be in the forefront of what we're trying to do as we move forward, especially through the summer months.
And Counselor, there's also a graphic, so you won't have to, it's not going to look like a message board, a signboard. It'll be a graphic that talks about, the distancing, the facial covering. There's signs that are being posted in multiple languages. We also, obviously tourism is taking a hard hit, but there are some expectation that there still will be people here. They will need to know what the rules are. We need residents to be vigilant about what the rules are. So the places that you typically go into, from laundromats to grocery stores, we're really hoping that these graphic type signs will continue to reinforce the need to maintain these practices. Are there any other questions? We can.
Council Dibble.
Thank you, Mr. President. Thank you, Mayor, for the update. Some good numbers there. Can I ask that going forward 2 weeks from now and after that, if we continue this emergency, that you share those numbers with us in advance so we can look at them and digest them, and then we might be able to ask questions rather than looking at them for just a second. I know that we looked at them for a second earlier this week as well. It would be good to share those. I'd like to hear from Dave on a couple things, if you can help us from a medical standpoint, from a health agent standpoint. North Shore Medical Center, I'm saddened that one person has died in Salem, but it's 24, and that's a lot of people. So I think we need to do more and get more information out, and we have a good opportunity here tonight with so many people now watching city council meetings at home. Dave, can you talk a little bit more about face masks in that I delivered a bunch more face masks today, and every day I seem to be doing that. But a whole bunch of seniors today I'm looking at, and they've been wearing the same paper face mask for almost 2 months. It just not, we need to do a better job on face masks and getting them to our seniors, our most vulnerable, as well as Spanish-speaking and other speaking residents. So a little bit on that. Can you also give a couple of points tonight to our residents at home and to our councils that we can share as well on some things that residents can be doing, like vitamin D, for instance. I thought it was vitamin C that would really help. Now I'm hearing vitamin D that's provided by the sun is a good cure and good helpful to get rid of COVID. And then, washing your sneakers soles with bleach and water, turning your sneakers upside down rather than bringing those shoes inside the house after you've been out shopping or somewhere else. Let the sun and the bleach kill the COVID. Can you give a couple of points like that off the top of your head that will help people at home right now?
I'll try. So around the facial covering things, I think it's important to note that when we talk facial coverings, we're not talking about N95 masks, surgical masks, things that the professionals really need. We're talking about like the homemade ones, the cloth ones, the thing Councilor Turiel talked about, the buff, or even just a plain old scarf that you can wrap around your mouth and nose when you're inside of an essential business, or around folks that you can't socially distance from. As far as things that you can use to clean, I think it's UV rays are a form of sanitizer. The sun does kill germs and viruses. You can certainly leave things out in the sun. I don't know the science of how long it takes for the UV rays to kill COVID-19. I'm not aware of vitamin D killing it, but using sanitizing wipes, cleaning wipes, you do all those things. Leave those things outside, and yes, the sun does have a sanitizing effect.
Yeah, we're really lucky. If I may continue, Mr. President, I have one more question for Dave and then one for the mayor. We're really lucky to have the North Shore Medical Center here in Salem. They're helping so many people from the entire region. But can you talk a little bit about some of the numbers and what's happening? I know that Salem Hospital numbers are declining with the number of patients at COVID, and I think it's substantial. And that's something the public should know so that we can relieve a little bit of the fear, but not totally where they stop wearing masks. Can you talk about the numbers a little bit at Salem Hospital? What in general, maybe?
So in general, I do know that the numbers are coming down. We have a weekly meeting with North Shore Medical Center and the Health Center. We get the information from them. Their numbers are down, I think, a considerable amount. They've discontinued use of their additional ICU rooms and beds that they had to stand up as part of this. I'm not sure right now what their ICU capacity is or numbers are, but their numbers are coming down considerably. When I give numbers, I'm only giving numbers for Salem residents that we have confirmed, have tested positive, have been confirmed to clear their isolation period, or, in the worst case scenario, have confirmed to be a fatality due to COVID. Because the hospital does service a wide region, we can't really report on what's going on at the hospital itself. But the mayor can tell you that we do speak to Dr. Roberts up there weekly, as well as some other members of his team as well.
Yeah, I probably talk with Dr. Roberts twice a week. We definitely have a weekly healthcare call with healthcare professionals to make sure that we're touching base on areas of concern, troubleshooting, and things like that. We actually asked Dr. Roberts to put out an update, just a little update to the community on what's happening at the hospital, how they get a lot of data as part of the partners team as well. So he's been a source of looking at modeling. It's great to see, all the different public health research models, and when they all agree, it's both comforting and scary at the same time. But he just released a video. I'm not sure if you saw it. It was a nice little clip, about 5 to 10 minutes, giving an update about how things are going at the hospital. He actually does that weekly for everyone, for the hospital community, meaning staff there, just to give folks an idea of what's happening, what are the key areas. It's not very long. This one he decided, we asked him to do something like that for the community. So it's a little more broadly focused. And I'm just so grateful to have, he's been a long time physician at North Shore Medical Center, headed the cardiac care unit when it was there, and has just been somebody that's been great to have with us as an ally in everything that we're doing. And obviously the staff at North Shore Medical Center have done some great work. And you mentioned the data, Counselor. I just want to let you know, all the data that we showed you is up on the city's website. We post regular COVID updates, and we always include those graphics. We think it's really important for the community to know exactly what whatever we know, what the case counts are, what the demographics are. We're trying to get more information from the state on our percent positives. That's been a little bit of a tug of war with DPH. So we don't just have the number of positive cases, but we know the number of negatives, so that we can understand, as one piece of data, certainly not the only one, from a testing capacity, what those percentage positives look like. So we're going to continue to try and grab that. But there's a dashboard that goes up regularly. We want people to have it. So if you need those slides that I showed today, they're up on the website right now, just so you know.
Yeah, I want to put a shout out for all the restaurants and pizza shops in Salem. So many of them, and it's too long to list, Mr. President, but so many of them are donating food to Salem Hospital and feeding the warriors up there. They're just working so many extra hours to help so many people. I think it's every day there's food being delivered up there. That's a wonderful thing. Mr. President, my last question for the mayor, and I bet she knows what I'm going to be asking about, because we talked about it last week and then we talked about it earlier this week, is on the golf course. It's about the only sport that we can practice social distancing on, and it's the only thing really that the city can make money on right now. So we're losing income on parking and all sorts of other revenue sources, but on golf we could be making money. So I wonder if the original intent was to be closed for the month of May, or why didn't we do the work in April, I can ask, and what can we do to get that thing open? Because when we look at $120,000 lost in the month of April, that's a lot of money, but there's nothing we can do about that. We have the ability to be open now in the month of May. I'm wondering how much money we're going to lose in May versus last May. Do you know what we generated in funds last May?
I don't have those numbers off the top of my head, but I'd assume it'd be similar to April. Weather sometimes accounts for that, but we can get if it's a nice spring, we can get a lot of rounds in up there for sure.
Yeah, in May, there's a lot more golfers. So if April last year brought in 120,000, maybe May bring over $200,000. That's too much money to pass up on. What can we do to get that golf course open sooner than June 1st?
Yeah, I appreciate you asking the question, and I'm glad to answer it again for you, so viewers at home can hear the same answer I gave you both on Saturday and earlier this week, which the golf course was closed obviously because of the emergency order. We took advantage of the spring to try and get the cart paths redone. For several years, the golf community has talked to us about the conditions of the cart path being really rough, and it's not the easiest area to reconfigure because of the nature of the greens around it. And we put out a bid. It was awarded. A contractor's been working on it. They couldn't do as much work as they were hoping to in the spring, largely because of the weather. It was wet, and you can do more damage to the course by working on it when it's wet, which would take longer to repair. So Paul Lever, I think you know Councilor Dibble. I'm not a golfer. haven't taken up the sport.
Nor have I.
But Paul Lever, the superintendent, really does an outstanding job keeping the golf course in tip-top shape. I don't know, I say to him, you only sleep at home. You really live at the golf course, because he is just so committed to making sure that the course is ready to play and safe. The course is not ready to play and safe right now because they're working on finishing up the cart pass. No one wants to turn away money or turn away golfers, but there's no way to open it until those cart pass are completed. The contractor was a little bit behind schedule, but they're working hard to get at it, and we're hoping to open, as I said earlier, by June 1st at the latest. If we can get open earlier, we will. We know there's a golf community that wants to get out there. I think Senator Lovely was with us saying she's been walking out there. The golf course is being used by non-golfers right now. Lots of people enjoying an opportunity to get a walk in and recreate. And you can see the status of the pass. They're getting closer. They're paving. The work should be completed soon. The pass will be done, and then we'll get golfing going as soon as we can. Under the new rules, there are no carts. There are certain limitations on how many people can golf at a time. No carts, no hanging out in the clubhouse and the like. But we want to get people able to recreate to the extent that they can. We were all, frankly, a little taken aback by the change in the guidance. We were not anticipating anything till May 18th. I think the governor decided to move a little bit closer, move a little bit faster on allowing golf. And so we're moving as fast as we can.
Yeah, I think it was a good thing that it's the only sport, again, that you can really stay 6 feet away.
I don't know about that, but we're certainly not anti-golf. We just want the course to be safe. I don't want folks going out there when the paths are not completed, and there's areas around the greens that need attention. So I'll let you know. You can be the first one out there when it's open, Counselor.
I golf once or twice a year on average the last 30 years. Thank you, Mayor.
Yep.
Anyone else? Seeing none. Mayor David, thank you once again for taking the time and keeping us up to date on what's going on. Appreciate it. With that, I'll recognize Councilor Marcillo.
Thank you, Mr. President. I'd like to move that we return to page 4.
Councilor Marcillo moves that we return to the regular part. Actually, page 3, Council. We still have to do public testimony.
Oh, page 3.
Thank you. We'll move to page 3. Seeing no objection. Madam City Clerk, I believe you spoke when we spoke earlier. There's 2 people signed up for public testimony. If you could recognize.
Right. Can Councilor Marcillo just move receive and file for the update from the mayor and
Could you move to receive and file the update from the mayor first before we move?
So moved.
Councilor Marcillo moves to that this matter be received and filed. All those in favor? All your hands. There they are. There they are all. Thank you. See 10 hands plus my own 11. Councilor Marcillo also moves to go back to the regular portion of the agenda on page 3. All those in favor? All those opposed? Seeing none. I don't have to hit it that hard because I'm the only one in here. With that, we'll go to public testimony on page 3. Madam City Clerk, will you recognize the people who signed up?
Yes, the first person that signed up for this evening is Yelena Yano, and I'm going to where did you go? All right, Eleni, I'm going to unmute you, and if you want to unmute yourself and state your name and address for the record, please. You should be able to speak.
I saw his name pop up. I don't know what happened. Oh, there he is.
Okay. Eleni, okay, there you go.
Yeah, thank you so much. My name is Yoleni Inoa, 53 Clark Street, Salem, Massachusetts. I want to talk a little bit about ADU. I'm again to the ordinance. It had no affordability in it, and it does not help the affordable housing crisis in Salem. This ordinance will make it inherent for our residents, especially for our Latino community, for our immigrant community. This ordinance is not good for our city. Please vote no and save the real affordability and diversity of Salem. Thank you so much. I'm asking you to vote no in the ordinance. Thank you.
Thank you, Yeleni, and glad to see you out there. I'm glad you're feeling better. I heard you were sick, and I reached out to Councilor Dominguez to check on you, but glad that you're doing better.
Yeah, thank you so much for you worry about my health. I'm very good, healthy right now, and I'm fine. Thank you so much, everyone who sent me a message. Thank you.
Thank you. Madam City Clerk, the second person, please.
Yep, let me just, Remove Yeleni. Okay. And now our second person that wanted to speak that is on is John Casella. I'm going to allow you to talk. And if you can unmute yourself and state your name and address for the record, please.
Yes, my name is John Casella. I live on 8 Beckford Street. I've been here for about 46 years in Salem, so I'm not a new boy anymore. But I'm against this ADU proposal for several reasons. First, I believe there's some programs already in place. When we had the earlier hearing, I think Mr. Jenkins outlined a program that is in place that could be used to achieve many of these objectives. I don't think another program's needed. Second, when I looked at the program as proposed, there are several very specific covenants within that. That implies the requirement for compliance. Anytime you talk about compliance, you talk about the need for oversight, and that translates into headcount for the city. We're in an era when we should be reducing headcount, not increasing it. This will only further the cost of government, and we don't need that. Third, I think Salem should be congratulated for a very active program of affordable housing that's already in place. I look at the construction on, I believe, off River Street. There's a very large facility there. There's some others that are on the board, on the books. I think Salem is doing more than its fair share and should be recognized for that. Next, I'm opposed to this because it will increase housing density. We've had this discussion time and time again about COVID-19, and we're asking citizens to restrict their movement, to wear masks, to maintain social distancing. I think it's only consistent that the city not endorse a policy which would create greater density and only contribute to more problems with COVID-19. As I said, if you look at Milan and New York, one of the major causes of the problem there and the fatalities, unfortunately, was high density housing. We cannot endorse that, and it's not consistent with our other policies. How can we ask people to observe these, distancing, to wear masks, to limit their mobility, and at the same time the city is endorsing policies that would only contribute to the problem? I don't think the mayor wants to become the de Blasio or the Cuomo of New England by doing that. Next, I live on Beckford Street. We don't have any parking now. If we were to have these units, where are people going to park? What is going to be the impact on traffic, which we don't have any now, but it will return hopefully, and it's a major issue. The one other thing that gets overlooked is infrastructure. If you take a walk down Beckford Street in front of my house, it looks like an airport runway with all the markings on it for the utilities, the water, the electricity, the gas. And the issue is we have an aged, challenged infrastructure. We get brown water, we get sewer backup. If we increase density, it's only going to undermine the quality of this infrastructure and the quality of life for the residents. So for those reasons, I don't think we need a program, and the program as prepared will only create more problems than it solves. Thank you very much for giving me the time to speak.
Thank you. Madam City Clerk, I understand a couple more people signed up right at the end. Could we recognize them, please?
Yep. So the next person I'm going to recognize is Fuzzy. I'm going to allow you to talk, and if you can unmute yourself, you may speak.
Could we make sure we mute John, please? Thank you.
Yep.
Okay, good evening, everybody. First of all, happy birthday, Maureen. We start with a good note.
Name and address for the record, please, Fuzzy.
Sorry, Fawaz Abu Sharik, 4 Harrison Road, Salem, Mass.
Thank you.
And I do not support the ADU ordinance. It is a bad and not needed in Salem, and I respectfully ask the council to vote it down. It is the same as the one that was voted down last October, and there is no reason why it is back in front of the council today, especially during a pandemic. The council effort should be on how to support our residents and protect them at this hardship, and not go back to old business that is unnecessary. I'm not going to go through what the others spoke about. Yulani spoke about the affordability factor, and this does not have any affordability. It will not help with affordability. Flooding the market doesn't mean we're going to have cheaper prices. Flooding the market, it simply means whoever the market you are attracting, and since we are attracting higher markets like Boston, Somerville, Cambridge, that to come here, no matter how much we flood it with ADUs, it's not going to reduce, it's not going to cost any affordability. It's just another market. Actually, it might increase the rent on the already existing market that we have. The second point I want to bring here is we already have an ADU that nobody want to talk about or mention or do anything about it. It's like this black sheep of the ordinances that we're going to make sure nobody hears about it, nobody knows, nobody even go. It does give the help and the need for people who need ADU, for family, for caregiver, etc. I don't know why we're trying to take that one off the book and replace it with one that is not good for the city and it's not good for our neighborhoods. The last point here I would like to make is the R1. We all know R1 people paid a lot of extra money to live in those neighborhoods and to have that kind of living and that kind of quality of a neighborhood. This ordinance basically takes that away from them. And it will flood the neighborhood and it will hurt it, because even if you have an ADU, you all require is 1 to 1.5 parking spaces. Sorry. I apologize. It's just time to break fast, and I will do it after I finish. It's the Ramadan. So if you have an ADU and you rent it to a family of 4 people, even though all you're required to have is 1 to 1.5 parking spots, this family could have 4 cars, the husband, the wife, and 2 older kids. You cannot split a car in half. That's 3 cars on the street. So it does have many things to take away from the quality of those neighborhoods and for no benefit for the city. I know in my neighborhood, we are willing to do a lot for the city and the Salem State property when it's sold, if we can ensure the benefit of the neighborhood and the city. But this ordinance, we're taking away their money, their living, everything they worked for no reason whatsoever. And sadly to say, Mr. President, your Willows neighborhood is the one that opposes the most. When I went calling around and trying to reach out, the Willows people were the most people who did not like this. So I hope you stick with your neighbors. They're not going to tell you that to your face. You're the president of the council and you support the ordinance. They're not going to come and tell you I don't support it. It's just how people work in general. Anyways, finally, please reserve the quality and privacy that neighborhoods paid hard money for it, especially in the R1. Please do not take away a good ordinance and replace it with a bad one. Please, whatever you do, make sure it's good for the city and it's good for affordable housing, the thing that everybody talks about and nobody does anything for it. It's time to start doing it, not talk about it. Please, Salem City Council, vote the ADU down. It is not a good ordinance for the city. It's not a good, actually those ordinances are not good for any city, and most cities around went around from them, and we did speak about it in Seattle, in Indianapolis, and in most this. We need a comprehensive plan for the city, not spot zoning. What you're doing is illegal spot zoning, which is legal but not ethical. Let's take the city as a comprehensive plan and let's all work on it and do the best for the whole thing. Thank you. God bless all.
Thank you. Madam City Clerk.
Hold on, let me just, there we go. All right, and the last person that signed up at the end was Jeff Cohen. So I will Jeff, I'm going to allow you to talk, so if you want to unmute yourself, you should be able to speak now. Are you there, Jeff?
Thank you very much, Council President and the rest of the council. First of all, Fuzzy, I hope you had an easy fast. I am speaking in support of the ADUs. It seems like 10 years. I know it's been a couple of years. This should have been in place 2 years ago. Number one, there is no correlation between density and the spread of the COVID. Dave Greenbaum and the Board of Health sent out a notice for multifamilies that they had to have a notice that, which I have in my 4-family, that anyone, whether it's someone from outside or anyone who lives in the building, is required to wear a mask. We do that diligently. Number two, parking is mandated in the ordinance. So there's many potential ADUs that will not happen because they cannot conform to the restrictions in the ordinance. Three, Noah Koritz spoke several times during the meetings that the planning and council had together about how we have a deficiency of smaller sized units. These are 800 square feet and smaller. It will create natural affordability. And lastly, I want to address neighborhood quality. These units will be in an owner-occupied property. We do not give the citizens, the homeowners, the property owners, the homeowners of Salem enough credit. Who is going to build an ADU or has a multifamily that is going to rent it to someone that they think or will cause trouble in the neighborhood? And when someone does, they usually take action. I want to give an example. The short-term rental ordinance was passed. And one reason it was passed is because there were guidelines in it to protect neighborhood quality. Many counselors that are in the council now were very concerned about neighborhood quality. Many short-term rentals, Airbnbs and otherwise, throughout Salem have been cited many times by the police. There have been properties cited as many as 50 times. The ZBA has considered many investors coming into Salem, buying a multifamily and turning it into a virtual hotel. At virtually every one of those meetings, I was there to testify against anyone who was doing this to the extreme. One investor had 16 units, mostly in Ward 2, that was transferring from or wishing to transfer from a long-term rental to short-term rental. And yet the people who complain about the neighborhood quality, who are against the ADUs on the council, were not at these meetings standing up asking the ZBA to enforce the intent of the short-term rental ordinance. People in the neighborhood stood up against these investors, saying that it would damage the quality in the neighborhood. So you can't have it two ways. This will not damage neighborhood quality. People who are going to invite someone into their property in a unit like this is no different than someone who has a 2-family or a 4-family or whatever. They want the property to maintain and for everyone to treat their fellow tenants and neighbors with dignity and respect. So I am supporting the ADU. Thank you for your time.
Thank you. Madam City Clerk, are we all set on public testimony? You're muted.
Yep, we're all set. Thank you.
Thank you. Now we'll go back to the regular part of the agenda. Hearings, none. Appointments.
From the last meeting, the mayor's appointment of Darren Black to the Commission on Disabilities for a term of 3 years to expire April 23rd, 2023.
Council McCarthy. Council McCarthy moves to confirmation by roll call vote. All those in favor, all those opposed? Madam City Clerk I don't have.
Yes.
I just want to thank Mr. Black for his willingness to step up and serve in this very vital role in our city as we move forward. Obviously, the Commissions on Disabilities has a great role to play on how we move forward in making sure that our community is accessible for all our visitors as well as anybody with a disability. And I want to thank him for his willingness to step up. And at this point, I move for confirmation by roll call vote. Madam City Clerk?
Counselor Dibble?
Yes.
Counselor Dominguez?
Yes.
Counselor Flynn?
Yes.
Counselor Hapworth?
Yes.
Counselor Madore?
Yes.
Counselor Marcillo?
Yes.
Counselor Presnowski?
Yes.
Counselor Riccardi?
Yes.
Counselor Sargent?
Yes.
Counselor Toriel?
Yes.
Counselor McCarthy?
Yes. On the matter of the mayor's appointment of Darren Black to the Commission on Disabilities for a 3-year term to expire April 23rd, 2023. We have 11 members voting, 11 in the affirmative, none in the negative. The matter carries. At this point, I would ask for a suspension of the rules to allow Mr. Black to address the council if he so chooses. Is he in attendance, Madam City
He
Clerk?
is in attendance, and I just unmuted him. And if you unmute yourself, you can address the council if you wish to, Mr. Black.
Thank you so much for confirming me. I look forward to serving my new community, Salem, and lending my professional and personal expertise to better the lives of persons who live with disabilities. Thanks so much.
Thank you. Thank you. Further appointments or reappointments?
We have the mayor's appointment of the following: Susan Yolkison to the Tree Commission with a term to expire July 18th, 2022, and Cynthia Nita Soto to the Redevelopment Authority with a term to expire December 8th, 2021.
Council Terrio.
Thank you, Mr. President. I move they be held under the rules.
Council Terrio moves to be held on the rules. Further appointments or reappointments?
We have the mayor's reappointment of the following: Luis Matos de los Santos to the Youth Commission with a don't know that, sorry. With a term to expire May 14th, 2021, and John Boris to the Affordable Housing Trust Fund Board with a term to expire May 24th, 2022.
Council Flynn. Council, you need to unmute
Council
yourself.
Flynn, I muted you. Sorry.
That's okay. Thank you, Mr. President. I'd move for confirmation by roll call vote.
Council Flynn moves for confirmation by roll call vote. And under discussion, any discussion?
No, I'd just like to thank both these individuals for stepping up. Louis and John, very lucky to have them in Ward 4, and I appreciate the dedication and hard work. Thank you both.
Thank you. Anyone else? Seeing none. Madam City Clerk, will you please call the roll?
Councilor Dibble?
Oh, get away, get back, get back.
I don't know where that background's coming from, but it's not from my house. Yes.
Was that a yes?
Yes.
Thank you.
Councilor Dominguez?
Yes.
Councilor Flynn?
Yes.
Councilor Hapworth?
Yes.
Councilor Madore?
Yes.
Thank you.
Councilor Marcillo?
Yes.
Councilor Presnowski?
Yes.
Councilor Riccardi?
Yes.
Councilor Sargent?
Yes.
Councilor Toriel?
Yes.
And Councilor McCarthy?
Yes. On the matter of the mayor's reappointments of Luis de los Santos to the Youth Commission and John Boris to the Affordable Housing Trust Fund Board, we have 11 members voting, 11 in the affirmative, none in the negative. The matter carries. Communications from the mayor.
We have an order that the sum of $24,441.39 be approved within the Retirement Stabilization Fund for 3 DPS workers.
Council Terrio.
Thank you, Mr. President. I move for suspension of the rules.
Council Terrio moves for suspension of the rules. Seeing no objection. Council
Thank you.
Terrio.
Thank you, Mr. President. I also move for adoption.
Council Terrio moves to adoption. Under discussion, Council Terrio.
Thank you, Mr. President. We're losing 3 employees from DPS with this, unfortunately, who are retiring. I wish them all well, and I hope we can keep up. Thank you.
Thank you. Madam City Clerk, will you please call the roll?
Councilor Dibble,
Yes.
Councilor Dominguez,
Yes.
Councilor Flynn,
Yes.
Councilor Hapworth,
Yes.
Councilor Madore,
Yes.
Councilor Marcillo,
Yes.
Councilor Presnowski,
Yes.
Councilor Riccardi,
Yes.
Councilor Sargent,
Yes.
Councilor Torrio,
Yes.
and Councilor McCarthy.
Yes. On the matter of the appropriation of $24,441 in, how many cents? I can't read that. 39?
39.
39, thank you.
Yes, 39.
To be applied to the Retirement Stabilization Fund. We have 11 members voted, 11 in the affirmative, none in the negative. The matter carries. Page 7, we took care of. Page 8, motions, orders, and resolutions. Council Dibble.
Thank you, Mr. President. I don't have this in front of me, and I apologize. I usually have something from the city clerk that I can actually read. So I'd like to, and I
Yes, that was
apologize.
in City Council on May 14th, 2020, ordered.
I don't have it in front of me, so
That's how you start. That's all.
thank you.
Yep.
City Council, May 14th, 2020. Again, I don't know what to read. I don't have any.
Right on the page 8 on the agenda.
It's on the agenda, if you just read the agenda.
Page 8.
If I had a paper agenda, I would.
Oh, okay.
May I read it for you?
Yes, thank you, Mr. President.
Sorry.
Order that the city engineer, the city solicitor, and the city clerk shall work cooperatively, prepare the necessary plans and orders, and schedule a public hearing before the city council as soon as it is practicable for the proper acceptance of the following streets: Cedar Crest Road, Intervale Road, and Dave Francisco Avenue.
Yes.
And Councilor Dibble moves for, according to this, adoption.
Yep. I move to. I move for adoption. Yes, thank you. It's just to schedule a public hearing. Thank you. I move for adoption.
Council Dibble moves for adoption. Any discussion? Council Dibble?
Very briefly, this is something on 3 streets in Ward 7 that were recorded improperly years and years ago, decades ago. And it's something that we just need to straighten out. It's not the streets in their entirety in paper. It's a portion, and we'll clarify that during the public hearing. And I'm in support of this, but we need to hold a public hearing. Thank you.
Thank you. Anyone else? Seeing none, a Council Dibble's motion that this matter be adopted and a public hearing be scheduled. All those in favor, could I see hands, please? I see every hand, including my own. The matter is adopted. Page 9. Committee reports. Is there any other motions or orders? Anyone bringing in a late file? Seeing none. Committee reports. Councilman Madore.
Thank you, Mr. President. I also don't have the report to read in front of me, but I'll just improvise.
There you go.
Committee on Ordinance, License, and Legal Affairs co-posted with Committee of the Whole, to whom was referred the matter amending traffic, Chapter 42, Sections 50, 74, and 17A relative to crosswalks, has considered said matter and would recommend adoption for first passage by a roll call vote. And I move to accept the report.
On the acceptance of the report, all those in favor, all those opposed? Seeing no one opposed. On adoption of the recommendation, under discussion, Council Madore.
Should I make the motion first, Mr. President?
No, the adoption is for first by roll call vote. I will recognize that as soon as you, was there anything about this you want to talk about?
Sure. Thank you, Mr. President. We had a really good discussion, a really productive discussion around this matter. I believe it was filed nearly 2 years ago by the administration to prohibit parking 10 feet within the crosswalk on the oncoming traffic side. It was originally proposed by the Salem Police Department to improve safety around crosswalks. And as I had noted in the committee meeting myself, that this is one of the top complaints that I get from Ward 2 residents, since we're a more dense district in Salem that allowed the cars parked close to the crosswalk create a blind spot for pedestrians trying to cross the street. So there's a lot of close calls between pedestrians and cars. So this would effectively, quote unquote, daylight a crosswalk so that there's more visibility for traffic that's approaching a crosswalk. And I know that there's some concerns about the loss of parking, but my opinion is that the loss of parking is not as important as the loss of a life. So anything we can do to improve public safety is something that we can take action on. And I know that we had also discussed that we would move for first passage, and we'll get more information from the traffic and parking staff on inventory lists of crosswalks that would be impacted, and provide that to all the councilors for review if they have any additional comments or changes they would like to make before second and final passage. And I move to adopt the recommendation.
By roll call vote.
By roll call.
Thank you. Any further discussion? Seeing none. Madam City Clerk, will you please call the roll?
Councilor Dibble?
Yes.
Councilor Dominguez?
Yes.
Flynn?
Yes.
Councilor Hapworth?
Yes.
Councilor Madore?
Yes.
Councilor Marcillo?
Yes.
Councilor Presnowski?
Yes.
Councilor Riccardi?
Yes.
Councilor Sargent?
Yes.
Councilor Torrio?
Yes.
And Councilor McCarthy?
Yes. On the matter of the adopting the ordinance relative to the traffic chapter 42, sections 50, 74, and 17A relative to crosswalks. We have 11 members voting, 11 in the affirmative, none in the negative. The matter carries. The committee reports. Council Madore.
Thank you, Mr. President. Committee on Ordinances, License, and Legal Affairs co-posted the Committee of the Whole, to whom it was referred, the matter amending traffic chapter 42, sections 75, 51, 56, relative to Getney Street and Holyoke Square, has considered said matter and would recommend that it stay in committee. I move
On acceptance of the report, all those in favor, all those opposed? Let the record reflect that everyone raised their hand as accepting the report. On adoption of the recommendation, Council Madore. Any further discussion on staying in committee?
Thank you, Mr. President. Just very briefly, to summarize the discussion, I think the amount of time that has elapsed with this matter, I think it's at least this is around when I first got elected into office, so it's been a while. So we wanted to just go back and do some additional outreach with the business owners in the area, and just to do another look at the proposed changes in regards to parking limitations, just to make sure we get it right. And I think the only amendment that we voted on was around making residents on Getney Street Court eligible for the proposed resident sticker parking program on Getney Street. So we wanted to get more information back from traffic and parking before to make a more informed vote. So we wanted to keep this in committee, and I move for adoption of the recommendation.
Thank you. Any further discussion? Seeing none on Council Medora's adoption that this matter remain in committee. All those in favor? See 11 hands. All those opposed? Seeing none. Further committee reports. Council Medora.
Thank you, Mr. President. The Committee on Ordinances, Licensing, and Legal Affairs co-posted with Committee of the Whole, to whom it was referred, the matter amending Traffic Chapter 42, Sections 57C, 51B, 74, and 56 relative to Holyoke Square and Getney Street has considered said matter and would recommend matter stay in committee.
On acceptance of the report, all those in favor? All those opposed? Let the record reflect everyone voted to accept the report. On adoption of the recommendation under discussion, Council Medora.
Thank you, Mr. President. Very quickly, this is related to the previous order following the change in the parking around Holyoke Square when CDX Analytics had returned the parking spaces for the use of the public. This is related to the previous order, so we thought it should remain committee as well. I move for adoption of the recommendation.
Thank you. Any further discussion? Anyone? Seeing none on Council Medora's recommendation that this matter stay in committee, all those in favor? 11 hands. Thank you. Matter stays in committee. Further committee reports. Council Medora.
Thank you, Mr. President. City Council Committee on Ordinances, Licensing, and Legal Affairs posted with Committee of the Whole, to whom it was referred, the matter amending Traffic Chapter 42, Section 50A relative to handicap zones has considered said matter and would recommend that it stay in committee.
On acceptance of the report, all those in favor? All those opposed? Council Sergeant. Thank you. The record reflect there was 11 hands to accept the report. Under discussion, Council Medora.
Thank you, Mr. President. I just briefly summarized the discussion. So it was myself who originally filed this amendment, and the intent is to speed up the process of assigning handicap parking spaces, given that the need is usually urgent. So the discussion focused on how we can speed up that process. And I had also, it was my fault that I did not post the additional recommendations from the Traffic and Parking Commission and Department regarding Section 50B, which actually lists all the streets or lists all the locations where these parking spaces are, and recommending some ways that the process could be done administratively through the commission, the Traffic and Parking Commission. So because that matter was not posted in the agenda, we felt it was best to keep this in committee and have a fuller discussion next time.
Thank you.
Move for adoption of recommendation.
Thank you. Any further discussion? Councilor Dominguez, are you still with us? There he is. Okay. Sorry, because if you lost your video feed, we're going to have to take a roll call vote, but this is just to keep the matter in committee. On adoption of the recommendation that the matter stay in committee, all those in favor? Councilor Sargent, thank you. Matter stays in committee. Communications to city officials.
We have an order that the mayor is hereby authorized to execute on behalf of the city of Salem an easement agreement with Vavel LLC as set forth in an attached easement agreement and as shown on the attached plan entitled Parking and Access Easement and Exhibit for Loring Avenue, Salem, Mass, prepared for Vavel LLC on October 10th, 2017 by the Moran Cameron Group, Inc.
I believe this is Councilor Dibble.
Yes.
Councilor Dibble.
Thank you, Mr. President. I move to refer the matter to the Committee on Ordinances, Licenses, and Legal Affairs. Co-post it with the Committee of the Whole, please.
Councilor Dibble moves to move the matter to the Committee on License, Orders, and Legal Affairs, co-posted. Under discussion, Councilor Dibble.
Very briefly, this is an area along Loring Avenue, way down by, actually it's off of Route 1A. just past Vesuvius Pizza. It's about 220 feet along the right-of-way of Loring Avenue with frontage that long. I'm in support of this project and in support of turning it over to the developer to allow for more parking here. This is on a, I think it's luxury apartment complex that the developer was willing to reduce the size of the project and to move the building further away from the abutters buildings to appease them and to make it happen. So I think he took 2 stories off the building. And as a result of moving the building, he had to reconfigure the parking spaces. So he's looking for a little bit more land along the right-of-way that we as a city simply don't use. And I have some questions for the solicitor on the dollar amount of this. I think we're just letting it go for too little in forever, basically, for a one-time payment this year. I think it should be an annual payment like rent, like we do on other city properties where the clam shack and the newspaper stand and other places are using the land every single year. I think we should get paid some rent or something every year. So I just have some questions on that, Mr. President.
Okay, thank you. Any further discussion? Councilor Madore.
Thank you, Mr. President. Through you, if I could just ask Councilor Dibble to reach out to myself regarding the timing of scheduling the hearing, and mainly because I'm not sure what the construction schedule looks like. So I don't want to hold back progress on the project if that's the case.
Yep, okay, Councilor Dibble.
Thank you, Mr. President. Yes, thank you to our Ward 2 councilor for asking that. I'd like to recommend that she schedule the hearing as soon as possible. Not the hearing, but the committee meeting as soon as possible to allow the developer to continue on. It's not my intent to slow this down. It's simply just to have clarification that we're getting the correct dollar amount for city land, if you would. Thank you.
If we could address some of those issues with the city solicitor prior to the meeting, that would be probably the most helpful.
Done. Thank you.
Thank you. On Councilor Dibble, seeing any further discussion? Seeing none. On Councilor Dibble's motion that this matter be referred to the Committee on Ordinances, License, and Legal Affairs, co-posted with the Committee of the Whole. All those in favor? All those opposed? The record reflect everyone voted in favor. The matter goes to committee. Further communications from the city officials.
We have communication from the planning board regarding the zoning ordinance amendment below relative section 3.1, table of principal accessory uses regarding accessory dwelling units, and section 3.2.8.
Thank you. Council Madore.
Thank you, Mr. President. I move that this be received and filed.
Council Madore moves that this be received and filed. All those in favor? All those opposed? Let the record reflect no one was opposed, so this is the planning board's recommendations relative to ADU. So now we're on page, further communications from city officials.
This is for the zoning ordinance relative to the ADU.
We're on page 14.
Yep. And put section, that's for the table.
Yep.
Section 3.1.
Yep. Council Madore.
Thank you, Mr. President. I move that this be referred to the Committee on Ordinances, License, and Legal Affairs, posted with Committee of the Whole.
Council Madore moves that this matter be referred to the Committee on Ordinances, License, and Legal Affairs, co-posted with the Committee of the Whole. Any discussion?
No discussion.
Any from anyone else? Seeing none. On Councilor Madore's recommendation, this matter be referred to the Committee on Ordinances, License, and Legal Affairs, co-posted with the Committee of the Whole. All those in favor? All those opposed? What the Councilor Sergeant? Oh, sorry. Are you in favor or opposed? Councilor Sergeant. In favor or opposed? I'm sorry. You left your hand up. Could you just unmute yourself, just so I get it clear?
In favor of sending it to committee.
Thank you.
Okay.
Let the record reflect that 11 members voted to send it to committee. Further communication with city officials.
And we have the second planning board recommendation on the ordinance for section 10 definitions and section 3.2.4 and section 3.2.8.
So we're on page 20. Councilor Madore.
Thank you, Mr. President. I move to refer this to the Committee on Ordinances, Licensing, Legal Affairs, composed of the Committee on the Whole.
Council Madore moves to move this matter to the Committee on License, Order, Legal Affairs, co-posted Committee of the Whole. Under discussion?
Thank you, Mr. President. I attended the planning board meeting that they had last week, and that was a really good discussion. And they responded to some of the concerns around having additional density in the single family neighborhoods. And they felt that in response to that, they would like to eliminate the possibility of a detached ADU, which I agree. And I think the planning board member Helen Tsai, she made a really good point that if this was supposed to meant to be naturally occurring affordable housing, then building an additional structure, the cost of it is pretty high, and the ability to rent it out is also probably going to be at a premium. So it kind of defeats the intent of the ordinance. And there's a couple of small changes around tree caliper, just to make the language tighter. And I would like to move it to committee in case any council members of the council have additional questions, so we can answer it before we move forward with this.
Thank you. Anyone else? Seeing none, Council Madore's motion that this matter be referred to the Committee on License, Orders, and Legal Affairs, co-posted Committee of the Whole. All those in favor? All those opposed? Let the record reflect that everyone voted in favor. Thank you. Petitions.
We have one public guide license application.
Council Madore.
Thank you, Mr. President. I actually would like to move this to the Committee on Ordinances, License, and Legal Affairs.
Okay, Council Madore moves to move this matter to the Committee on Licenses, Orders, and Legal Affairs. Under discussion?
Thank you, Mr. President. I think we all received an email from the Salem Tour Guide Association today around the need to maybe revisit how and when we are issuing. Sorry, I just noticed my colleague from Ward 5 has a new friend. The concern around issuing these new licenses for tour operators, given that our local operators are experiencing a lot of hardship. And after reviewing the application, I noticed that the applicant is not based in Salem. So I just wanted to give it another look and understand the circumstances by which we move forward with these. So usually we have a big list of these coming almost every meeting. So I just wanted to take a closer look before we make any decisions that might hurt our local economy. Thank you.
Okay, thank you. Any further discussion? Council Madore's recommendation this matter be referred to the Committee on License, Orders, and Legal Affairs. All those in favor? All those opposed? Council Sergeant, that's a favor, correct? Thank you. He's kind of froze up. Council Sergeant, you're in favor, correct? Thank you. It's 11 in affirmative, none in the negative. Further petitions.
We have two drain layer contract operating license applications.
Council Madore.
Thank you, Mr. President. I move that these be granted.
Council Madore moves that these be granted. Any discussion?
No.
Seeing none, all those in favor? All those opposed? The record reflect 11 members voted in the affirmative. Further petitions.
We have 3 claims.
Council Madore.
Thank you, Mr. President. I move that these be referred to the Committee on Ordinances, License, and Legal Affairs.
Council Madore moves that these matters be referred to the Committee on License, Orders, and Legal Affairs. All those in favor? All those opposed? Let the record reflect that the vote was 11 to none in the matter of sending the claims to committee. Unfinished business, none. Anyone have anything else? Councilor Dibble.
I almost lost you there, Mr. President. Thank you.
No, don't do that.
No, I don't know what happened there. The whole screen disappeared and I came back. I just want to point out again, as I've done, and thank you for allowing me to do it in the past. And I apologize, I didn't ask you in advance, but on the face masks, they're still needed. And if you want a washable and reusable cloth mask delivered free of charge to your house, made by volunteers in Salem, really good quality, they seem to last. I've washed mine some 15 times. Simply email me, sdibble@salem.com, or telephone me at home, 978-744-7315. I'm in the City Hall listing, and we will get you a mask. The volunteers in Ward 7 have sewn probably about 5,000 masks and delivered them all over the place. So thank you for that.
Thank you. Councilor Madore.
Thank you, Mr. President. I would like to ask for a point of personal privilege.
Councilor Madore.
Thank you, Mr. President. I hope my colleague from Ward 6 does not mind me doing this, but I just want to ask for a moment of silence to share that our deepest condolences to the counselor's family since she had lost her stepmother this week. And I just want to share that we appreciate all that she is doing for the city, and given current circumstances, it's a very difficult time to grieve as a community. And I just want to be present with her and let her know that we're all thinking of her and her family.
Well said. Thank you. Councilor Flynn has his hand up. You need to unmute yourself, sir.
I can't hear you.
Thank you, Mr. President. I'd also like a point of personal privilege.
Councilor Flynn.
Yeah, I'd also like to ask for a moment of silence for 24 victims of COVID-19. It's very sad to see this number grow. Every meeting, there's more and more people, and losing 24 of our citizens is devastating. So I'd just like to give a moment of silence to these 24 victims that have lost their lives to this disease, and to end this meeting. Thank you.
Thank you, Council. Before we take a moment of silence, I'd also like to take a quick second to recognize our city clerk. Our city clerk lost a family member as well this past week to actually the COVID virus itself. So, so as we end the meeting, before we adjourn, we'll take a brief moment of silence for, obviously, everybody's been affected by this. I mean, I don't think anyone has gone untouched. And I think we'll just take a quick second to reflect on the fact that, you know, it will get better at some point, but it may get worse before it gets better. So if we could just take a moment of silence and reflect. Thank you. Council Sergeant.
Move for adjournment, please.
Council Sergeant moves for adjournment. All those in favor? All those opposed? We stand adjourned. And I will say for the record one more time, I miss you guys in here. I'm here by myself. One day soon, I hope to have you all back. We stand adjourned. Thank you so much.
Thank you. Good night, everyone.
Good night.
Good night.